National leader Christopher Luxon has been directly challenged at Ratana to stop being afraid of co-governance. But Luxon fired back yesterday, calling the wider conversation about co-governance divisive and immature. Christopher Luxon is with us this morning to discuss. Morena, good morning.
Good morning, good to be with you.
First, I wanted to ask your reaction to the very sad news overnight, the death of Te Whai Harawira.
Yeah, I never had a chance to meet her or get to know her at all, but I mean, what was obvious to me was she was a fantastic advocate for Māori, particularly around loss of language and loss of land. I think the way that she provoked politicians but also supported them was pretty special. And I remember her saying, be polite but always be honest. And I think not a bad way to be able to live and to be able to discuss some difficult issues at times with each other. We can disagree without being disagreeable, but always say what you think. Yeah,
right. Well, let's hear from you then, because as you said, Te Whai Harawira was very big on speaking your mind. And you did that yesterday at Ratana. Chris Hipkins hit back and said on co-governance, he said there's a particular park in the Hutt Valley in his electorate, Te Whiti Park, which has long been managed by co-governance between Māori and between the government or the local council. He says no complaints, great facilities, in fact better facilities than there were before. It's working well. Do you have a problem with that?
No. So really the issue is this, which is that if you think about co-management or co-governance as it was previously used, it was in the context always of local iwi working with local government to manage local natural resources in the context of treaty settlements. And by and large those arrangements have worked incredibly well because Māori have fantastic contributions to make and into decision making around those kind of assets. What we're talking here, though, is over the last few years, the government has done something different, which is to start to take that word, co-governance, and put it into a completely new and different context, which is centralised bureaucracies for the delivery of public services. And that's been my frustration, and as I've said to the Prime Minister before, is, hey, listen, on a constitutional issue like co-governance of public services, which are designed for all New Zealanders, health, education, justice systems, critical infrastructure like Three Waters. That's a different case, and from my point of view, that's what I was saying yesterday.
Okay, so okay with the park and the Hutt, that's cool. Co-governance of the Waikato River, you're fine with that too?
Yep.
That's working
I think those arrangements have worked incredibly well.
So co-governance of natural resources like that, you're okay with. What is the difference? So would you say then, in regards to the Waikato River, that you are in support of the co-governance of natural resources like that?
Yeah. So
So what's the difference between that natural resource and Three Waters?
Yeah, so essentially those natural resource, those co-governance arrangements around local natural resources have often been done in the context of Article 2 of the treaty, which is fantastic, and we support that, and that's been positive, I think, by and large. What I'm talking about, though, is that actually having separate healthcare systems, education systems, justice systems.
But that's the hang on.
That is the delivery of public services, and that is a very different thing.
Let's take Three Waters. You're okay with the co-governance of a particular body of water, but not national bodies of water. Why?
No, what we're talking about with respect to Three Waters, that is about infrastructure. That is about pipes and the management of stormwater, wastewater, fresh water, and that's a different issue in the sense of those assets paid for by local government, local citizens and ratepayers. They should be returned to them, and there isn't a role for co-governance in that kind of conversation. What we're talking about is the delivery of co-governance of public services, and that's what I came to Ratana yesterday, and it was raised with me at Ratana. And I thought it would be disingenuous not to say what we think about that.
Okay,
so we can, because my argument's very simple, is public services are designed for all New Zealanders. We have one government, they deliver a public service to all New Zealanders in need. That's the basis for what we do.
But does a river not provide a public service?
But within that one system, we can target, say for example, Kura and Karangareo schools will still exist, but we do it within the coherence of one education system, not two separate education systems.
Okay, so do you think that a separate health system is being created in the development of the Māori Health Authority?
Correct. So I see that as two separate systems, and that's why I think that the Māori Health Authority should be scrapped.
Okay. So the Māori Health Authority, as you'll be aware, has iwi Māori partnership boards. Do you know what they do?
Yes, and they exist, that you can have iwi partnership boards that exist within the current one healthcare system or one Ministry of Health as it is today.
But there's not going to be a separate hospital for Māori?
No, but there is.
So it's not going to be a separate health system.
Yeah, but that's where the clarity.
Do you know what the budget is for health versus Māori Health Authority?
I don't know
it's
that.
It's $15 billion for the health system, and about $168 million is all they've allocated so far for the Māori Health Authority. It's hardly a separate health system.
All I'm saying to you very clearly is that in the delivery of public services, we should not have two systems, two separate systems. We should have one system. We can have innovation within that, delivered those services by Māori, for Māori.
But why is it okay for a river? Why is it okay for a park and not for the health system?
Well,
what is the fundamental difference?
Well, the government hasn't made the case for that. You know, they haven't made the case
because
the
case against it?
The public services are designed for all New Zealanders to deliver, and we target New Zealanders and support New Zealanders on the basis of need. And so what we want to be able to do is target those needs, meet those needs within one system. You can have charter schools, for example, within an education system, but it's within the confines of one coherent
all right.
system.
So here's an example then. So let's say we keep the health system as it is, but because presumably you want to address the 7-year inequity in terms of lifespan between
Absolutely.
Okay,
Absolutely.
so we've got the health system as it is, and then would you be okay with then iwi providing their own health services and being funded by the taxpayer to do that?
They do that in many cases today within the existing system.
Cranking it up.
That's what I'm talking about. Absolutely,
okay.
because
is that not so?
Because what I'm trying to say to you is, look, I'm interested in outcomes, right? Really strongly. We have real challenges around, Māori health outcomes. Fully understand that. But over the last 5 years, this government has not delivered a single improved Māori, health outcome.
Understand that.
And under the Māori Health Authority, by its own admission, it's saying for another 5 years it won't deliver an improved outcome. Okay. A decade of no improved outcomes is unacceptable. Now, we can have one healthcare system that actually targets people on the basis of need, and that may be through the use of other community organisations as well as Māori or iwi organisations.
Is the money that would otherwise be spent on the Māori Health Authority, you will take that money and you will give that to iwi to deliver health services?
Absolutely, because what I'm really...
So there's at least $170 million from your budget that you will be giving to iwi to deliver health services.
Yeah, because I come from a different place, which is that I think that actually delivering those services, there's not one mode of delivery out of Wellington that has to deliver those services. Actually delivering those services through community organisations that are closest to the people and to the challenges that are on the ground is the right way to do it. At the moment, so much of our money is lost in the bureaucracy of Wellington.
Okay.
Our healthcare money at the moment is being spent building mega bureaucracies in Wellington when we believe in localism and devolution, and those closest to it should deploy it and actually deliver it. I think you've got community organisations that can deliver food lunch programs into schools much better than Wellington can. Yeah. I think Māori health organisations can actually deliver Māori health services a hang of a lot better than what the government can do centrally through Wellington. So one system, one coherent system, innovation within it to target people on the basis of need, delivered through community organisations, fully supportive of. That's about getting outcomes, and that's what I'm passionate about.